unfortunately, it's not a positive experience. So here are just a couple of things that carers have told us as part of Carers Voice project. So I don't feel listened to, and no one has ever asked me if I am a carer for my husband. My husband, with an end-of-life condition, was discharged in the middle of the night in the winter wearing only a t-shirt. The care and compassion I gave as his carer, I felt it was completely disregarded. Sadly, the carer that we spoke to about this, her husband passed away. But this is a memory that she cannot forget. She keeps saying that this is a memory that she keeps going over and over in her head about how he was treated on discharge. Information was withheld, inconsistent and rushed, and I felt like I was part of a relay race. The support for carers stops once your loved one is admitted to hospital. And we were also told over and over again, lapses in medication information and missed opportunities have been a reoccurring theme when we've been speaking to carers. Next slide, please. So what are the core objectives for H Connect? So it's about identifying carers early in the hospital journey, involving carers involving carers meaningfully in treatment and discharge planning, reduce hospital readmissions through better carer support, and improve outcomes for carers of all ages, backgrounds and communities. Next slide, please. So if you're not based in Derby or Derbyshire, these wards and hospitals won't mean much to you, but I wanted to add these to the slide because they're actually an important part of how we chose to work with H Connect. As part of Derbyshire Carers Association, we've done a lot of work with hospitals, but we've never done a piece of work where we've worked so closely with hospital wards. So it was really important for us that we started small and that we built on it because we wanted to learn as we go on. Our Carers Voice project continued to be a big part of this, so we continue to listen to carers and their experiences to try and learn from that. But we've also worked very closely with a number of small wards. So the wards that we're currently working on is the Macmillan unit at Chesterfield Royal Hospital, Cubley Court, Kingsway Hospital, Radbourne unit, also at Kingsway Hospital. And I should add that those two wards also have the triangle of care in place. So some of the work that we've been doing is looking at how can we align with the triangle of care. Ward 3 and Ward 5 at Florence Nightingale Community Hospital and Cavendish Hospital in Buxton, which, if anyone knows, High Peak it's quite an isolating area for carers. We've also been doing two pieces of system change work. So we've been working quite closely with the Care Transfer Hub in Chesterfield, and we are due to do some training with care coordinators that are going to be in place around about January. And we've also been working closely with the dementia team at Derby Royal Hospital, and we're currently having a look at reviewing the existing carers passport. Next slide, please. It's quite interesting because one of the things that I'm doing outside of work is I'm doing a bit of a course, and last night I was doing a module about presenting and he said it was really bad to use pictures, and I started to panic because I know that there's pictures on this slide, but if you're anything like me, you prefer pictures, because I do prefer visuals rather than a lot of words. So how does H Connect work? The first thing that I've mentioned here in the top corner is DACS. So DACS is our contracted service within Derbyshire, and this stands for Derbyshire All Age Carer Support Service. And it's really important that I mention this because when we're talking to people about the work that we're doing in hospitals, one of the things that they bring up is the importance of that preventative way of working to reduce hospital admissions. And we do that through Derbyshire All Age Carer Support Service. So we work closely with GP practices, and it's a very similar model to H Connect, where we support them to work towards being carer friendly. We have a carers in employment model. where we work with employers to support people within their workforce who are carers, and we work very closely with other services, health, social care and community services. And we talk a lot about making carers everyone's business, because we can't be everywhere as a service. We have around about 200 referrals per month of new care referrals, but we know that there's a lot more carers out there that we need to identify. So we always say that partnership working is so important to us as a service. So before I talk about H Connect and the work that we do as part of the discharge planning, there is a lot of preventative work that we are also doing as part of Derbyshire Carers Association. So back to H Connect. So what we decided was to have a similar model to our GP liaison work that we're doing, and that we would support hospital wards to work towards being carer friendly. When we first introduced this, we thought that we would find it hard to sort of sell it to hospital wards. Professionals are really busy, they lack capacity, they work shifts. So it wasn't something that we thought that people would be readily sort of putting themselves forward for, but we were very wrong. We actually ended up with quite a list of people that was interested in taking part in being a carer friendly ward. So although we started off with pilot sites, once we come to the end of our pilot sites, we will be then going to other wards that have shown an interest in this. So the first thing that we started off with doing is allocating our pilot site wards with a H Connect hospital liaison worker. And that H Connect hospital liaison worker is there to support them to work towards being a carer friendly ward. So we do that a couple of ways, but one of the things that we first start with is providing care awareness training to all hospital teams that is able to attend it. And this care awareness training is about us talking about who is a carer and what support is available for a carer, particularly local support. So what's available within the community for carers, and also the legal rights and the importance of identifying carers, and also including them in discharge planning conversations. So the training is the first thing that we would start with. When we started to get to know wards, they also talked about how they would like to learn a little bit more about what was available for carers. So on top of our care awareness training, we also introduced a programme which is called Call for Carers. Call for Carers is a six session programme which covers various themes, which is all around supporting carers. So this could be planning for the future.
She must be 84 or 5.
Oh, so this could be planning for the future. It could be benefits. It could be accessing support for your loved one. But that programme is there just to give hospital staff a little bit more knowledge and confidence when they are talking to carers, so they know what is existing within the local community. So once we've done that training, one of the things that we have to ask hospital wards to do is pledge. So what are you going to do to support carers on this ward? And it's been really exciting actually to hear all the different pledges that have come forward. So we've had some wards that have introduced coffee mornings, carer support groups. Some wards had no information whatsoever for carers on their wards, so they introduced carers boards. We've had some wards that have introduced a carers theme within their regular meetings, added a question about carers on their forms that they use on the wards. So there's different pledges that have come forward, but that is one of the ways that we're able to measure whether or not they're doing something on their wards to support carers. What we also did was we wanted to tackle this from various directions. So we also wanted to be visible. We know that this project is going to create a lot of referrals, and it already has started to do that. So we didn't want to create a bottleneck within carers services, whether it be our services or another service. So what we did was we also introduced an engagement worker, and the engagement worker is there to provide ongoing support to carers that we come across. So the support worker attends coffee mornings, support groups, they facilitate carers clinics, and they're there to offer that one-to-one information, advice and guidance to carers in that moment, rather than carers being referred to the carer service and sitting on a waiting list. They still have the option to be referred to a carer service, but it just means that we're not creating a waiting list, and we're also not putting more pressure on our existing carer support worker team. And also as well, the carer engagement workers have been working really closely with the hospital wards, and they've built up a really good rapport with the professionals. So one of the other things that we have done as part of H Connect is we've had a look at how can we make sure that every single ward that we're working with has accessible and inclusive resources available for carers. Because we know that carers can self-identify, and that's not always relying on professionals to identify them for us. So we've helped wards design carers boards. We've made sure that they have up-to-date information and resources available for carers. But what we've also introduced is a H Connect Professionals Resource Hub. This is one of the ways that we're thinking that we need to continually think about how is this work going to be sustainable. So on some of the wards that we've come across, they're already existing carers champions, or there are people that have come forward that want to take a bit of a lead in this. So we've designed a professionals resource hub, and it is something that we are still working on. And this has various different bits of information, from the training that is available right through to resources, posters and leaflets that they can download themselves and use on their ward. That way they're not always relying on a member of H Connect to come into the wards and replenish the carers board. So that's a really good way of making sure that information is being kept up to date. So you'll notice on here that I've also popped down community grants. So when we first started this, we were really mindful that we didn't want to sort of keep it to ourselves as a service. We are very big on partnership working, and we know that we can't do everything as a service. So we had to think about how else can we include other community services, and we knew that we had the money to be able to offer grants. So around about July, we put out some grant applications and said, if you have any ideas of how you can support carers across Derbyshire and Derby, we would really like to hear from you. So from that, we now have 9 community services across Derby and Derbyshire that are providing additional support for carers. So we've got a great podcast. We have additional carer support groups, we have wellbeing activities, we have some therapy, and we also have some support to get carers back into work, as various other things. So that's working really well to ensure that we're connecting carers to what is available in their local community. And again, it's not putting too much pressure on the local carer support workers. Next slide, please. Thank you. So one of the other things that we wanted to do as part, and there are different ways that we're evaluating this and measuring the success of this project as we're going along. But one of our partners is Derby University. So we thought actually there's some really good work that we could do here. So we employed a research associate, I think their title is. So the aim of the research was to improve awareness, inclusion, early identification of carers within hospital discharge pathways in Derby and Derbyshire. So the research has started, and the outcomes of the research will be available in spring 2026. So if there is anyone on this call who is particularly interested in the outcomes of this research, please reach out for me, because we'll be more than happy to share it with you. But the objectives of the research is to gain insight into carers' experience of discharge process, with particular emphasis on communication between themselves, healthcare staff on the wards and other MDTs, understand the barriers and enablers of carer identification and self-identification within the discharge process, and from here develop a co-designed support resource which can provide pre and post discharge support for carers. Next slide, please. Thank you. So I'm not a researcher, so I'm not going to go into too much detail about this, but this is a qualitative piece of work. So the phase 1 is what we're currently doing at the moment, and this is done as one-to-one interviews or group discussions with carers. And then phase 2, which starts in January, is going to be one-to-one interviews or group discussions with healthcare professionals. And we hope to work with the pilot sites that we're currently working with at the moment. So we're recruiting carers across Derby and Derbyshire to take part in this, and then we'll be recruiting healthcare staff. And the interview schedule will cover care awareness, inclusion and identification within the discharge process, as well as communication between carers and NDTs. So I don't know if anyone knows anything about the combi method, but how it works is our researcher needs to understand the current behaviours within hospital teams. And the only way that they can do that is by talking to carers and talking to health professionals. And then the combi method works that if one of these components, whether that be capability, motivation or opportunity, is missing, it means that the behaviour won't happen. So in this case, the behaviour being identify, support or involve carers in discharge planning. So at the moment, they're gathering all of this valuable insight to have a look at what is happening and what we need to change to ensure those behaviours happen. And as I say, the outcome of this piece of research will be available spring 2026. Next slide, please. So when we first started working with our pilot sites, we started with a baseline. We wanted to find out where are all of these hospital wards at the moment, so we can then have a look at the distance travelled at the end of the work that we're doing, can track what it is that the wards are doing, the impact that it's making, and hopefully get some really good carer stories and case studies as well to back that up. So what we found, so hospital teams had not previously undertaken care awareness training. So apart from the 2 wards that we're working with that have the triangle of care in place, none of the other hospital professionals we spoke to had undertaken care awareness training. Information displayed on wards was outdated and some wards had no information at all. We actually visited one ward and the information that they had was 10 years out of date. And it was the information of a service that was no longer contracted to cover that area. Approaches to identifying and signposting carers were inconsistent across wards and teams. Since COVID-19, hospital teams reported reduced awareness of available community services and limited knowledge of Derbyshire All-Age Carer Support Services, and I should add here also Universal Services for Carers, which is our Derby City Carer Support Service. We were quite surprised that we were still hearing COVID being mentioned. But one of the things that we were told is that since COVID, health professionals felt that there was a bit of a disconnect between what was available within communities. So we know that there is some work that needs to be done there. And that's one of the reasons that we introduced Call for Carers, because we knew that we could connect health professionals with other services. Hospital teams were not fully aware of carers' legal rights to be involved in discharge planning, patient consent. Interaction with carers was limited, reflecting gaps in staff understanding and knowledge of carers' roles, and hospital teams reported lacking the understanding and confidence needed to approach carers effectively. I think because we've managed to go into the hospital wards and some of the feedback that we've had is that we've gone in there with a very flexible approach. There has been no judgment in terms of how they're currently working. So hospital teams and professionals have felt that they've been able to open up to us. And what we've found a lot is that professionals are saying actually they don't feel like they have the confidence or knowledge to approach carers, particularly because they don't know what's available for them. So quite often carers aren't being asked, are you looking after someone or do you help someone? Next slide, please. So, I mean, we have only been going since January, so it's still early days. I'm really hoping there's going to be a lot more that we can add to this. So these are some of the impacts that we've had to date. So we've reached and provided information and support to over 387 new carers. Now, the reason we've put over is because we will be having referrals that come through to us as a service, but we're not necessarily sure where the referral is coming from. As you might know, we have a lot of carers. Carers feel quite overwhelmed by all the support that all of a sudden can come their way. So when they come to us for support and we ask how did they hear about us, they're not always sure because they may have been involved in several services. So that number could be a lot higher than 387. We've consulted with 330 carers about their experiences of hospital discharge process and some of the work that we have planned going forward. We will be using this insight. We've worked with and will continue working with pilot sites towards our Carer Friendly Quality Award. We've delivered care awareness training sessions, that's over now, to over 60 health professionals. We've supported 2 pilot sites to set up carer support groups, and we've got another 2 pilot sites that are interested in doing the same. We've supported 82 carers, and this was only since July, through the H-Connect community grant. So that's the other 9 services that we've now got offering support across Derby and Derbyshire. We've provided 533 resources to hospitals. And just underneath there is a couple of quotes from carers who have told us how they feel in terms of the support that they're receiving from the pilot sites that we're working with. I won't read them out, but it's no surprise that both of these carers have mentioned 2 things, and we consistently hear this from carers, is that they felt listened to and that they were given time. So we're not asking for the unaskable of hospital wards or professionals. We're just asking to give carers time to listen to them. They know more about their loved one than any health professional do. So it's so important that they are part of that discharge planning conversation and that they are asked if they're caring for someone, so they can be signposted to crucial support, which hopefully will reduce the chances of carer breakdown. Next slide, please. So the next step, so we've got quite a lot of plans. I mean, one of them is that we want to look for continued funding. There is so much that we want to do as part of this. We feel like we've only just touched the surface on what's possible. So we're currently working quite closely with our local authority to have a look to see what the options are in terms of continued funding for this piece of work. But in December, so next month, we're going to start designing digital care awareness training offer, so bite-sized videos. So we know that not every health professional can attend the training that we provide. They work shifts, they do nights, they lack capacity. So we want to make this model as flexible as possible. We're working really closely with Live Life Better Derbyshire to deliver a campaign around Know Your Numbers. So this is around the wellbeing of carers, and Know Your Numbers about blood pressure. So that's going to be something that we're going to be delivering across Derby and Derbyshire. We want to widen H-Connect reach. So we're going to be working with the wards that have come forward to say that they're really interested in being part of this. So there's a lot more work that we need to do to create carer-friendly hospitals across Derby and Derbyshire. We're going to expand our resources to include easy read and translated formats. So part of our carers' voice is also about how can we make our resources and the information that we're sharing more accessible and inclusive. So we delivered a listening event, I think it was around about August time. And it was to carers from ethnic minority communities. And we wanted to understand the barriers a little bit more about reaching out for support, or what stops you from reaching out for support. And a lot of what we told us was around resources, posters, leaflets. So we're now working with these carers to design easy read and translated formats. So we're going to build on the work that we're doing within the care transfer hubs and the dementia teams. We're going to capture health professionals at the beginning of their career. So as I say, one of our partners is Derby University. So we're going to be having a look at how we can provide care awareness training to health students. It's something we have done in the past, but we want to build on that. And we're going to continue our delivery of Call for Carer programme. So we're coming towards the end of our first programme, and it's our first ever programme. So we've learned a lot from that. And then we're going to be introducing our second programme from January onwards. And I think that is the end of my slides. It is. So yeah, I will put out to anyone who's got any questions. But as I say, if I can't answer, I will take it away and make sure I get back to you. Okay. Any questions?
Brilliant, thanks, Emma. Sorry, can people just put
go
their
for it,
hands
Jim.
up? No, I was just, it's okay, Rachel, if you're here, so I'll pass over to you. You there, Rach?
Oh,
No,
we lost her.
Sorry,
Nope.
IT gremlins today, and I couldn't get myself off mute. I do apologise. Thanks, Jim. And Emma, thank you so much for the presentation. You would never have known this wasn't your area.
Oh, thank you. Thank you. I have been involved in it, just not as involved as Steph. And it's a real shame that she couldn't be here, because I know that she would have loved to be able to talk about all the work that they've been doing, because they are a fantastic team.
Yeah, it sounds like great work, and I can see hands are going up straight away. So let's start taking some questions, and then we can have a look at any questions that might be in the chat. Caroline, good to see you. Did you want to come in?
Yes, thank you for that. It's really inspiring. I wish more people could see and hear that. But one of the things, how are you getting on with the university? Because after 25 years of campaigning for carers, I actually have come to the conclusion that the only hope we've got now at getting anything really endemic is to get back to the training, basic training, both for social workers and for men and for health professionals too, and their staff.
Absolutely, Caroline, and that's exactly why we're doing it. So one of the things that as we've been doing this project, we've learned that we can't just rely solely on being visible or doing care awareness training, and we have to tackle this from various directions. So if we want to create a culture of people considering carers from the start, like you say, Caroline, we have to go right back to those that are being trained. We're very lucky here in that we have someone on our board of trustees who works at Derby University, and she's so passionate. Yeah, she's so passionate about carers. So there's a lot of work that we do with Derby University, from placements within our service. Our researcher is from Derby University. We have our board of trustee who's on Derby University and helps us with our outcome measures. So I think because we've already got that contact, then it's a lot easier for us to get into Derby University. But we do have some big ideas. So whereas before we've done some training with social care students and nursing students, but we actually want to widen that, because we're thinking of doctors, we're thinking of nurses, we're thinking of OT students. So when we're looking at all of these different health professionals, we want to be able to capture them from the start, because the amount of time we've spoken to professionals and we've mentioned about carers, and we assume as a caring service that everyone thinks about carers. It's not the case, unfortunately. So we really do need to get in there from the start, Caroline.
They don't understand how much carers know about the patient, that they
absolutely.
will never know. My husband was very good at indicating that he could do this, that, and the other. Could he help?
Yeah. And just to sort of add to that as well, Caroline. So one of the things that we have here is we have a carers helpline. The amount, I couldn't even tell you how many carers, because it really is a regular, frequent conversation that we have. The amount of carers that will tell us that they wasn't involved in the discharge planning, and that their loved one had told the team something that was completely inaccurate about their capabilities of when they return home. So it ended up being an unsafe discharge with the incorrect support available at home. And it was because they didn't involve the carer within the planning conversation. And actually, if they would have heard that a lot of the support that their loved one relies on, actually they're able to do those things because of the care that they have from their carer. So it's really important that carers are involved in that discharge planning for the reasons that you've just mentioned, Caroline.
Brilliant.
Thanks so much, Caroline and Emma, for your responses. We have got a couple of questions in the chat. Before I go to those, I just wanted to check if anybody else wanted to come in and ask any questions, or if anyone who's put a question in the chat wanted to come in and talk to that question. Okay, I can't see any hands up, but do just pop them up at any point. Emma, there is a question in the chat around whether or not some of the findings from your work are being fed into kind of colleagues who work in the digital areas, so computer programs, etc. It's a comment that too often boxes to tick don't necessarily work for carers. Now, this is Linda's question, and Linda's just put her hand up, so I'll let Linda come in. Hi, Linda.
Hi, yes, nice. Thanks very much indeed. So good to hear all of this. I think one of the things that worries me is that very often the NHS is a very big family, and sometimes if you're not a professional, that they may look at you askance somewhat. And I think that's also built on some of the unfortunate responses that some maybe anxious members of a family, should we call it, their behaviour. And so that's one of the strong reasons for defending against that. Have you come across that?
Could you ask that again, please, Linda?
Sorry, can you not hear me? What I was saying was, first of all, thank you very much indeed. This is great. But that the NHS thinks of itself as a large family, and that carers and members of family members and so on are not members of that group. Therefore, they almost make an assumption that we can't know too much as carers, which is wrong. But the other observation is, is the fact sometimes the poor behaviour of some families also put people off actually not recognising that what they see of as maybe even aggression could actually be severe anxiety. Yeah,
absolutely, Linda, and I do think that comes across. I think that happens more than we think it does. So quite often when we're speaking to carers, this sometimes happens with us as well. So when carers are identified to us and they're registered to us, sometimes we're starting off on a conversation with carers in a place where we know that they are frustrated, they're angry, they feel let down, they feel ignored. And this is because they have gone through the system and been passed on so many times that by the time they come to us, then actually we're just another service that is going to let them down, not listen to them, not give them space to talk about their loved one, or not be taken seriously. So I do sometimes think what happens is that because carers are so used to being let down or being passed on, that when it comes to working with health professionals, particularly on hospitals, they already feel that actually I'm frustrated, I'm not being listened to, I'm not being included in the communication here. And then what perhaps tends to happen is that hospital teams aren't involving them, they're not talking to them, they're not identifying them as carers. And we did actually have some professionals say to us that one of the things that they find most difficult is when they do come across confrontational carers. And it's perhaps understanding a little bit more about actually why are they confrontational, because we know that we as a service we can actually have several different referrals for one carer. So that tells us that someone has identified a carer and they've had several services all involved at the same time, which is fantastic because someone's identified that they need support. But actually what it also means is that services aren't communicating. So we're duplicating work, we're overwhelming carers, we're probably giving them 12 leaflets to go along with all of those referrals as well. So there is definitely a communication barrier for various different reasons. But yeah, carers are frustrated by the time it gets to point of discharge. Discharge. Thanks, Linda.
Yeah, thanks, Emma. I think it's such a valid conversation, isn't it? And I think some of the things that you've spoken about around really kind of listening and trying to understand and being curious, that kind of extends, doesn't it, to sometimes when people are feeling frustrated, because the more we do that, the more we might understand where that's coming from. So yeah,
absolutely.
Great.
And I should just answer as well, because I know that on one of the slides we mentioned about consistency, and it goes back to what Caroline said. In the actually, if people are recognising carers from the start, from the minute they start working within hospital settings. What that brings is a consistent way of working, and it means less frustrated, angry carers.
Yeah, and a system where carers expect to be worked with, and staff expect to identify carers. Yeah, great.
Absolutely.
So thanks so much, Emma. There's a couple more comments in the chat. Mary Patel's with us today from Carers Trust, and has just popped in the chat that they are next year expanding their work on Triangle of Care to include acute health trusts, and they'll be looking for examples of good practice such as yours. So that's what to bear in mind. You may get a call from Carers Trust at some point, or can liaise with Mary on that.
Lovely. I was just going to add, Rachel, that we're actually working very closely with Carers Trust on caring matters, and also Bridget Care. So yeah.
Marvellous. So Mary's also asked in the chat, and Mary, if you're here, do come in. But if not, I'll make sure we get these questions out there. So Mary's also asking if you could tell us a little bit more about the Carer Friendly Quality Award, and is this focus on staff carers as well?
So we have two streams of work that's happening. So the Carer Friendly Quality Award, it's something that we have within H Connect, so our hospital work. We also have it within our discharge liaison project, so working with GP practices, and we also have it with our employers carer employment service. So we support hospitals, GP practices and employers to work towards a carer friendly quality mark. So the carer friendly quality mark, I'll talk about H Connect, there's slightly different criteria depending where it is, but H Connect, the criteria is that they attend the carer awareness training session with a view to sort of saying if they get new members of staff, because we've got high turnovers on some of the wards, if they get new members of staff, they'll ensure that they also engage in care awareness training. So they have to attend the care awareness training. They have to ensure that they have something visible on their wards, whether that be a carers board or leaflets, and they have to make sure that the information that they provide is accessible and inclusive to people who attend the wards. And then the other thing that they have to do is pledge. So that pledge can look, we've sort of got a bit of criteria so they can go through some ideas of what they would pledge for, but the pledge is all around improving identification and communication and involving carers in that important conversation when it comes to discharge planning. So the pledges are all around how can you evidence through that pledge that you're going to do this. So then we work with them, we review them a couple of times through the work that we're doing, and the engagement worker will work very closely with them and making sure that we're identifying carers and supporting carers at the same time. And then when we feel that they've worked towards being a carer friendly service, there's a little mark that they get to say I'm carer friendly hospital or ward, and they get a certificate. And then they'll get ongoing support. They can access our hub, they can download resources. But in terms of carers who are employed, so our carers and employment service works very closely with hospitals to ensure that they're doing the same for employed carers. So an example of that is here in Derbyshire, Derby and Burton Hospitals is actually already a carer friendly hospital for carers in employment. So we work very closely with the carers that are employed within those hospitals to ensure that they're getting the support that's needed from their employer. And we've also supported them to look at policies. They've got a network, so there's various things that's happening there as well. So we sort of targeted it from every angle.
Lovely, thanks so much, Emma. And I can see, Nancy, you've put a comment in the chat around the link between carer voices not being heard and failed discharge, and whether that's something that we could somehow feedback on next year. I mean, that's certainly something that we can take into to NHS England and have a conversation around whether or not that is available data. We'll pick that up and see whether that is something that we might be able to do. Did you want to come in, Nancy?
Yeah, I was just going to say, so many of our carers are struggling when they get the call and they're at home, and understanding what that nurse or whoever it might be, it's usually a care coordinator, I think. I'm just trying to think about some of the recent conversations I've had with discharge teams, and we're really sort of, we're trying to explain to so many staff, we know that they're really busy, we know that they need the beds, and we know that they need to clear people out as quickly as possible, and we also know that we don't want people in hospital unless they really have to be there. But that conversation that happens over the phone sometimes when carers are not entirely sure what's going on themselves, they don't even have a clue that their loved one might be, or their friend, whoever it might be, is being even thought about for discharge, and then they get that call, so and so's coming home, and that panic, and then they're straight on the phone to my team and sort of saying, I can't have them back, you know. So there's been an awful lot. So it's almost easier if we've got the carer and the cared for on the hospital ward, because we can try and sort of advocate and do a lot of that MDT stuff with them and for them. It's when those calls come and someone's at home and it's, you know, late in the evening or it's a weekend, and, you know, and it's all panic stations really. And I just wonder how many, I hate calling it failed discharges, but, you know, that readmission is due to the lack of, as we know, sometimes the planning of having someone home, and actually understanding what all of that entails, because a lot of the carers that we support are frailer than the person that they're caring for. So, you know, it doesn't always work. So I was trying to, I didn't really know how to type that, but I definitely think there's something as we get through winter that we could perhaps congregate together again in the first part of next year to see how we all fared, really. It was just a thought.
I'd be interested in being part of that as well, Nancy, because a lot of the calls that we get very similar to what you've just explained, and actually that's why this was chosen as priority for the Accelerating Refund Fund, is because we knew that carers within Derby and Derbyshire felt very much let down. And it's quite interesting really, because when you listen to carers, it's usually one or two things. One is that they wasn't involved in the conversation at all, or the other one was that it is assumed that they are going to take on the carer responsibility. That there's no in between that says, okay, let's work together to make this work to reduce readmissions. And that's what we're really trying to get across as part of this project.
And it's difficult, I think, when your hospital splits between different local authorities. We're finding that out. I know Jill's on the call as well, so she'll probably be grinning in the background, but we've got that in South East Essex at the moment, especially in my patch. I split between a city council, a county council and 2 district councils. So everyone's got a different kind of view on what should happen really. So we'll see how the winter fares. But thank you anyway, it's a great project. I'd love to be hearing more about the research as well, Emma. Thank you.
Thank you, Nancy.
Thank you. Linda, is yours a legacy hand, or did you want to come in and make another point?
Picking up on both what Nancy said and what Emma said earlier, it's about the when staff are looking at what is the priority they're being asked, one of the strongest ones is to either not have people come in the first place, or to be at home for whatever reason. And I do wonder sometimes, you mentioned, you know, that the direct question is to the patient, who is so desperate to go home, I would say 99 times out of 100, that they are really sometimes not prepared to acknowledge, or can't acknowledge, what in fact is done for them at home. And you stand there as a carer and you say, you're almost being challenged to, do I put up a bit of a fight here? And
of course you do not. So as part of the discharge arrangements, I absolutely think that involving right at the outset both parties, so that the conversation is across the board from the beginning, can be helpful. So that if that frail, as I think it was Nancy mentioning, carer, which it often is not able to really do what is going to be asked of that person, then one finds it out good and early. I just wanted to add to that.
And you are right, Linda, in that discharge starts at admission. So really carers need to be identified at admission. And it's quite interesting what you say, because one of the things that's also coming up is the need, or there's a gap for some advocacy training with self-advocacy training with carers, to give them the confidence to be able to sort of talk about their needs and how they feel that they need to be involved. And you quite right pointed out, a lot of the times the cared for I don't like the term cared for, but I will use it, but the cared for wants to return home, so they're under pressure as to, do I support that, or do I actually speak up and say, no, I don't think they should come home, or I'm not ready to do this role. So we are going to be doing some self-advocacy training as well with carers. That's one of the things that we're hoping, if we can get funding, that we can continue to do.
Can I just say that I always said every patient needs a champion?
Yeah.
So what I was looking at was being a champion always, and that the heart of being a champion is ask polite questions, because that actually is a way into what's going on. You make yourself a partner within it if you can ask, because very often I think people don't. As carers, you just take what's told to you. But if you say, why, those blood tests, could I share? Could you talk to me about them? That sort of thing.
Yeah,
Thanks.
I agree, Linda.
Yeah, thank you. I'm just mindful of time. So what I'm going to suggest is that I've just noticed in the chat, Jim, that you want us to do the national update at the end. I'm going to suggest that we send that round after we can pull that together to send round after the meeting, and give Lisa and Caroline an opportunity to ask. Been waiting quite patiently. Is that okay? But we've literally got about 2 minutes per
I'll
question
be quick.
to include an answer, unfortunately. But it's good to see you, Lisa.
Thank you. There was I've heard of the carers quality marks before, previously before I started my role as a commissioner within the county council at Lincolnshire. And my question is, and it doesn't need to be answered now, but is there a national standards for carer quality marks, because of that consistency in what we deliver? And if there isn't, I think we don't do carers quality awards in Lincolnshire anymore. I know that we have the quality markers within the GP practices. It would be great in the future if we had something which was standardised as a professional body, has that professional kind of legislation with it. I think that's something that we should all consider.
Yeah, I agree, Lisa.
And then the second point is advocacy. So I am part of the National ADAS group that comes together. And for anyone that don't know, that's the Association of Directors for Social Services. And advocacy is on our plan on a page as a priority. So I have just done a research on advocacy services available specifically for carers. So that came back, the literature research came back on Monday. I haven't had a chance to go through it and do what with it. But I think that is a wider than Lincolnshire issue, which will be connected to the ADAS work, but again could be shared wider in terms of that advocacy role, which is incredibly important. Maybe not 2 questions, maybe just 2 suggestions.
Yeah, Lisa, yeah, I'd really like to see that work that you've been doing. That'd be great. And I agree about the quality mark as well, definitely.
Thank you.
We've noted that, Lisa. Thanks so much for your comment.
Thank you.
And Caroline, did you want to come in for the last question?
I think that remark about Carers Trust, triangle of care, always sparks in me. I mean, my volunteering has been done for Carers UK, but the Carers Trust triangle of care, I just wish it wasn't just mental health. It should be social and medical services in general that apply to. That would help to get that pair, sort of getting together. I think in a sort of visual way. I think it's brilliant.
Oh, thanks so much, Caroline. And I know that Carers Trust are doing work to roll that out further beyond mental health wards. So it's really positive that you agree that what they're doing there is a good thing. So thank you. As I said, we will I'll work with Steve and Jim to circulate a national update and make that available. And so sorry we didn't manage to get to do that today. And thank you so much for your engagement, and thanks, Emma, for your presentation. Another great session, and we'll look forward to seeing you all in 2 months' time. Stay in touch in the meantime.
Thank you for having me.
Thanks so much. Take care.
Thanks,
Bye
everyone.
everyone. Bye bye.
Bye.